Well, it sure is fun to play in the snow, but you can seriously hurt yourself when you slip and fall on the ice. That's an example of some of the winter wipeouts that are very common this time of year. Dr. Jennifer Wolf, an orthopedic surgeon with UConn Health Center, is here to talk about that and a lot more. Dr. Wolf, thanks for joining me.
Thank you for having me.
So let's talk about this. You specialize in hand surgery, so you see a lot of patients coming in, and explain why.
Definitely. At this time of year, we see people falling on the ice. We see people all time of year, though, with carpal tunnel syndrome, with trigger fingers. One of the other winter injuries I see are things like, so falls on the ice, distal radius fractures, so wrist fractures or wrist injuries.
And the reason why we're talking about wrist injuries is because when you want to try to break that fall, you put out your hand. That's your instinct there.
You put out your hand because you don't want to fall on your head or your back, although sometimes I tell people it'd be easier because when they fall on their hand, often we at the very least need to immobilize them in a cast. Further, we often need to do surgery or reduce their fracture. Push on the fracture to get it into the right place, or do surgery to put the fracture in the right place with a plate and screws.
What are other common pains that you see? You were mentioning earlier to me, of course, skiers, snow skiers, people who use snow blowers. Explain that.
So some of the pains we see with skiers are skier's thumb, which is the injury that occurs to the thumb joint, actually the metacarpophalangeal joint of the thumb, when people put their thumb through the loop of their ski pole and they fall and it's ski pole and the loop pull actually their ligament and tear it. That often requires surgery as well. We can treat some of those non-operatively in a cast, but the completely torn ones need surgical treatment.
So we've listed all of these problems and these accidents, but more importantly, let's talk about ways to avoid.
So ways to avoid them. One, with snow blowers, which we're using a lot of these days, never put your fingers in the snow blower. If it gets blocked, there's always one more turn in it, even after you turn it off. So use something else, a stick, a long piece of board, something to remove the blocked snow, not your hand, ever.
Not your hand, not your fingers.
Ever. And never put your finger through the loop of your ski pole.
Okay, and let's talk about when treatment is necessary. What are some options that we're talking about? Are there some options that are minimally invasive? Are there options, let's just talk about the whole gamut of options here.
Sure. Well, some of the treatments that we can do, there's lots of non-operative treatments for many things that I see. Carpal tunnel syndrome in particular, we can treat people with splints, with injections, but often those people do end up needing surgery. In terms of fractures, there is some treatment we can do with arthroscopic treatment. So we can do arthroscopy of the wrist or of the elbow to do treatments for certain fractures and certain injuries.
And what's the recovery time on this? Because some people, you've got to get back to work. So how does that work?
One of the things I tell people with hand injuries in particular, that most of the things that I do, particularly around the wrist, don't need to immobilize their fingers. So they can drive, they can write, they can type, they can do all those things right away. But they do need to immobilize their wrist, and sometimes their recovery time is 4 to 6 weeks or longer.
All right. I guess the common thread here is just be careful.
It is.
And be cautious. Okay.
Yes.
Thank you, Dr. Wolf. I appreciate it.
Thank you for having me.
Thank you.